Good evening, and thank you for joining us. Tonight, President Biden is trying to get a handle on two legacy-defining crises. His administration is grappling with how to evacuate those thousands of Americans and Afghan civilians after the Taliban takeover. We'll have late reporting on that in just a moment. The other crisis, COVID's summer surge, with new evidence that vaccines lose effectiveness over time and with the Delta variant raging. The administration is recommending COVID booster shots for adults who've received either the Moderna or Pfizer vaccine. And the boosters should come 8 months after their second dose. The first will be available the week of September 20th. Well, as of tonight, nearly 90 million Americans who are eligible for COVID shots have not even had one. And tonight, this news, the president is forcing nursing homes to get their staffs vaccinated or risk losing Medicare or Medicaid funding. There's a lot of news to get to, and CBS's David Begnaud is going to lead off our coverage tonight in hard-hit Monroe, Louisiana. Good evening, David.
Good evening, Nora. You know, the FDA's got to approve this booster plan, and so does the CDC advisory panel, but there's no reason to believe that won't happen. Dr. Fauci told me tonight that if you got Pfizer or Moderna, you're going to want to stick with the same manufacturer when you go back to get a booster shot.
Today, in what the president said was an attempt to stay ahead of the coronavirus.
My administration has been planning for this possibility in this scenario for months. We purchased enough vaccine and vaccine supplies so that when your 8-month mark comes up, you'll be ready to get your vaccination free.
This booster strategy comes from data which shows that the vaccines are losing efficacy over time.
The current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout.
The case for boosters is building. 3 studies published by the CDC today show that the effectiveness of vaccines against infection declined when the Delta variant began circulating. One study examined the records of more than 10 million New Yorkers and found that vaccine effectiveness against infection in May was 92%, but then it dropped to 80% months later. Yet at the same time, protection against hospitalization continued.
Dr. Fauci, if the vaccines are diminishing over time, how many boosters do you think people are going to need?
I would doubt if we're going to need many boosters when we try to find out the breadth and the depth of the response by a booster. It is really extraordinary. It goes up by multiple fold, at least 20 to 30 fold. So we don't anticipate that beyond this we're going to need anything else.
There is reason for worry. This country is averaging 500 COVID deaths a day. President Biden lashed out at governors that he claims are playing politics with safety measures.
We're not going to sit by as governors try to block and intimidate educators protecting our children.
211, I'm en route.
The surge through southern states is overwhelming. 27-year-old Trent Tarbutton is a field supervisor for Acadian Ambulance in Lafayette, Louisiana.
I think we have 3 of them right now currently waiting.
He took us to Lafayette General Medical Center, where there were ambulances lined up. He says recently paramedics have waited between 30 minutes and 3 hours.
We kind of just have to tell the hospital, like, look, find something. We don't care where you put this patient. You have to put them somewhere because we need to run emergencies.
Despite transporting COVID-positive patients weekly, medic Brittany Deku is not vaccinated.
You're up close with it. Does that not change your opinion?
No. Me and my family are very religious. We pray a lot. We trust God.
You know, Louisiana set another record today, highest COVID hospitalization rate of any point in the pandemic. And that's impacting non-COVID patients. Just yesterday, a man in central Louisiana had a heart attack, went to a community hospital, and they said, you got to go to a larger hospital for advanced care. So they called around for 2 hours. They looked 100 miles around, and they could not find a single available bed. Nora?
This is affecting so many people. David Begnaud, thank you.